Hernias might sound like a complicated medical issue, but they're actually quite common. Think of it like this. Imagine a strong, sturdy wall with a weak spot. That weak spot can bulge out under pressure, creating a noticeable bump. That, in essence, is what happens with a hernia. Now, why should you care? Left untreated, a hernia can cause discomfort, pain, and even lead to serious complications. In some cases, a hernia can become strangulated, meaning the blood supply to the bulging tissue gets cut off. This is a medical emergency and requires immediate attention. The good news is that most hernias can be effectively treated, often with minimally invasive techniques. Understanding what a hernia is and how it's treated can empower you to take control of your health. Our bodies are marvels of engineering, intricately designed to perform countless functions every single day. Beneath our skin lies a complex network of muscles, tissues, and organs, all working in harmony to support our movements, protect our vital organs, and maintain our overall health. The abdominal region in particular is a powerhouse of activity. It not only houses important organs like the stomach, intestines, and liver, but also relies on a strong muscular wall to keep everything securely in place. This wall, made up of layers of muscle and connective tissue, acts as a natural barrier, providing both strength and flexibility as we bend, twist, and lift throughout our daily lives. These muscles and tissues are constantly engaged. Whether we're simply standing upright, laughing with friends, or engaging in more strenuous activities like lifting heavy objects or exercising, they contract and relax, creating a dynamic support system that adapts to our every move. When everything is functioning as it should, this system keeps our internal organs exactly where they belong, preventing them from shifting or protruding. However, sometimes this natural barrier can become compromised. A hernia occurs when there's a weakness, tear, or opening in the muscular wall of the abdomen. This weakness can develop gradually over time due to factors like aging, repeated strain, or even genetic predisposition. In some cases, it might be present from birth, while in others, it can result from injury, surgery, or increased pressure inside the abdomen. When this protective wall is weakened, it creates an opportunity for internal organs or tissues, most commonly a portion of the intestine or fatty tissue, to push through that vulnerable spot. This protrusion can occur suddenly, such as after lifting something heavy, or it may develop slowly over time, becoming more noticeable as the weakness worsens. To better understand this, imagine a balloon being pushed through a small hole in a cardboard box. The balloon represents your internal organs or tissues, while the cardboard box stands in for your abdominal wall. The hole is the weak spot or defect where the hernia forms. As pressure builds up inside the box, the balloon finds the path of least resistance and begins to bulge out through the opening. This simple analogy helps illustrate what happens inside your body. The abdominal wall is meant to contain and support your organs, but when a weak spot develops, it can no longer hold everything in place. The result is a bulge or lump, which is the hernia itself. Depending on the size and location of the weakness, the hernia may be small and barely noticeable, or it can become quite large and uncomfortable. This bulging often creates a visible lump or swelling under the skin, especially when standing, coughing, or straining. It may disappear or become less noticeable when lying down or relaxing. For many people, this lump is the first and most obvious sign of a hernia. Some hernias may also cause discomfort, pain, or a feeling of heaviness in the affected area, particularly after physical activity or prolonged standing. If you notice a new lump or swelling in your abdomen, it's important not to ignore it. While hernias are common and often treatable, they can sometimes lead to complications if left unaddressed. The good news is that medical professionals are well equipped to diagnose and manage hernias, and there are a variety of treatment options available depending on the type and severity. In the next section, we'll explore the different types of hernias, their specific characteristics, and what you can do if you suspect you might have one. For now, remember that a hernia is essentially a structural issue, a situation where something inside your body pushes through a place it shouldn't, due to a weakness in the protective wall that's meant to keep everything in its proper place. Hernias are a common medical condition, but many people are surprised to learn that they can actually occur in several different areas of the body. Essentially, a hernia happens when an internal organ or tissue pushes through a weak spot in the muscle or surrounding tissue wall. The location of this weakness determines the type of hernia a person develops, and each type has its own unique characteristics, risk factors, and symptoms. Let's take a closer look at the most common places where hernias can develop, and what makes each type distinct. The most frequent type of hernia is the inguinal hernia, which occurs in the groin area, right where the thigh meets the lower abdomen. This area is naturally weaker in men due to the way male anatomy develops, which is why men are much more likely to experience inguinal hernias than women. In fact, about 27% of men will develop an inguinal hernia at some point in their lives, compared to only about 3% of women. These hernias often present as a noticeable bulge in the groin, which may become more obvious when standing, coughing, or lifting heavy objects. Sometimes they can cause discomfort or pain, especially during physical activity. Femoral hernias are another type that also occur in the groin, but they are located just a bit lower than inguinal hernias, near the upper thigh. These are less common overall, but they are seen more frequently in women, particularly older women. This is because the shape of the female pelvis creates a slightly larger space through which tissue can protrude. Femoral hernias can be harder to detect, and may not cause symptoms right away, but they carry a higher risk of complications, such as becoming trapped or strangulated, so prompt medical attention is important if one is suspected. Umbilical hernias develop around the belly button or navel. They are especially common in infants and young children as the muscles around the umbilicus may not fully close after birth. In most cases, umbilical hernias in children resolve on their own by age 4 or 5. However, adults can also develop umbilical hernias, often due to increased pressure in the abdomen from obesity, pregnancy, or heavy lifting. In adults, these hernias are less likely to go away without treatment, and may require surgical repair if they become painful or enlarge over time. Hiatal hernias are a bit different from the others, as they occur inside the body rather than creating a visible bulge. In a hiatal hernia, part of the stomach pushes up through the diaphragm, the large muscle that separates the chest from the abdomen. This type of hernia is more common in people over 50 and can cause symptoms like heartburn, acid reflux, and chest discomfort. Hiatal hernias are often discovered during tests for other conditions, since they may not always cause obvious symptoms. Incisional hernias can develop at the site of a previous abdominal surgery. After an operation, the abdominal wall may be weakened where the incision was made, making it easier for tissue or organs to push through. These hernias can appear months or even years after surgery, and are more likely if the wound did not heal properly, if there was an infection, or if the patient has risk factors like obesity or chronic coughing. Incisional hernias can vary in size and may require surgical repair, especially if they cause pain or grow larger. Understanding the specific location and type of hernia is crucial for both patients and doctors. It helps guide the diagnosis, influences the choice of treatment, and can even affect the urgency of care. Some hernias are more likely to cause complications than others, so knowing exactly where a hernia is located and what type it is allows healthcare providers to recommend the safest and most effective treatment plan. If you suspect you might have a hernia, or if you notice any unusual bulges or discomfort, it's important to consult a medical professional for a proper evaluation and guidance. While anyone can develop a hernia, there are certain factors that can make some people more susceptible than others. Hernias occur when an internal part of the body pushes through a weakness in the muscle or surrounding tissue wall. And although this can happen to anyone, understanding what increases your risk can help you take steps to protect yourself. Age is one of the most significant risk factors. As we get older, our muscles naturally lose some of their strength and elasticity. This weakening of the abdominal muscles is a normal part of aging, but it means that older adults are more likely to develop hernias than younger people. Even simple activities like coughing, sneezing, or standing up can sometimes be enough to trigger a hernia in someone whose muscles have weakened over time. Genetics also play a crucial role. If you have a close relative, like a parent or sibling, who has had a hernia, your own risk is higher. This is because some people inherit naturally weaker connective tissues, making them more prone to developing hernias even if they lead otherwise healthy lifestyles. Family history is something you can't change, but being aware of it can help you and your doctor make informed decisions about prevention and early detection. Chronic coughing is another important factor. Conditions like asthma, chronic bronchitis, or even long-term smoking can lead to persistent coughing, which puts repeated pressure on the abdominal wall. Over time, this constant strain can create or worsen weak spots, making it easier for a hernia to form. Managing chronic respiratory conditions and avoiding smoking can help reduce this risk. Straining during bowel movements, especially if you deal with chronic constipation, is another common cause. When you push hard to pass stool, you increase the pressure inside your abdomen. Over time, this can weaken the muscles and tissues, making it easier for a hernia to develop. Eating a diet high in fiber, staying hydrated, and exercising regularly can help keep your digestive system healthy and reduce the need for straining. Heavy lifting is a well-known risk factor, especially when done with improper technique or without adequate support. Whether it's lifting boxes at work, moving furniture at home, or even lifting weights at the gym, putting too much strain on your abdominal muscles can lead to hernias. Learning and practicing proper lifting techniques, using your legs instead of your back, and asking for help with heavy objects can all help protect your abdominal wall. Obesity is another significant factor to consider. Carrying excess weight increases the pressure inside your abdomen, which can weaken the muscles and tissues over time. This added pressure makes it more likely for a hernia to develop, especially in areas that are already vulnerable. Maintaining a healthy weight through balanced nutrition and regular physical activity can help lower your risk. Pregnancy is also a common risk factor, particularly for women who have had multiple pregnancies. The growing baby puts increasing pressure on the abdominal wall, and hormonal changes during pregnancy can further weaken the connective tissues. After childbirth, the abdominal muscles may not fully recover, especially if pregnancies are close together. Prenatal care, gentle exercise, and postpartum support can help strengthen the abdominal muscles and reduce the risk of hernias. It's important to note, though, that while these factors can increase the likelihood of developing a hernia, they don't guarantee that you will get one. Many people with one or more of these risk factors never experience a hernia in their lifetime. Your overall health, lifestyle choices, and sometimes just luck all play a part. The good news is that being aware of these risk factors gives you the power to make positive changes. By maintaining a healthy weight, practicing safe lifting techniques, managing chronic health conditions, and seeking medical advice when needed, you can significantly reduce your risk of developing a hernia. Remember, knowledge is the first step toward prevention and a healthier, more active life. Hernias often announce themselves with noticeable symptoms, but sometimes they can be, a bit subtle. Common signs of a hernia include a bulge or swelling. This is often the most obvious sign, especially when you're straining or coughing. Discomfort or pain is another one. You might experience a dull ache, a feeling of pressure or pain that worsens with activity. Some people describe a burning or even a gurgling sensation near the hernia site. Nausea or vomiting can also occur, especially if a hernia becomes strangulated and cuts off blood flow to the intestines. If you notice any of these symptoms, it's crucial to see your doctor for proper diagnosis and treatment. Remember, early detection is key. Don't hesitate to seek medical attention if you suspect you might have a hernia.